A new emerging drug threat has made its way to North Carolina. We're talking about xylazine. Thanks for joining us. I'm Dan Haggerty.
And I'm Ashley Rowe. Xylazine has already been detected in 18 counties across our state, the most recent in Robeson and Durham counties just last week. It's typically used as a tranquilizer for horses.
Mixed with fentanyl, it's considered a deadly combination. As WRL's Destiny Patterson reports, this mixture has led to a national response from the White House.
A drug not typically meant for humans is growing in prevalence. Xylazine has been increasingly detected mixed with opioids like fentanyl.
We're seeing a pretty rapid proliferation of xylazine in the black market or street opioid supply.
The Drug Enforcement Administration warned communities of the deadly combination. In 2022, roughly 23% of fentanyl powder and 7% of fentanyl pills seized by the DEA contained xylazine.
We usually don't know what's in the drug supply until it's too late, either when people are arrested or they're dead.
Most people who are opioid users aren't expecting this to be in their drugs.
Both Nabarun Dasgupta and Colin Miller have studied drugs and overdose prevention for more than 35 years combined. Their work at the UNC Street Drug Analysis Lab has opened the door of exploration on xylazine, also known as tranq. Since its only FDA approval is as a veterinary sedative, it's not been widely tested for or even researched.
We don't have a lot of medical understanding about what xylazine does to human bodies.
Xylazine is known to slow the heart rate and even cause wounds that heal like burns. Now the White House's goal is to reduce overdose deaths from that combination by 15% within the next 2 years. Overdose deaths in 2021 increased 22% in the state. More than 77% of those deaths likely involved fentanyl.
We've seen it in urban areas, we've seen it in rural areas, we've seen it in the western parts of the state, out to the coast.
While the DEA says Narcan does not reverse its effects, Dasgupta says people should still have it on standby.
All the xylazine that we are seeing in North Carolina is found with fentanyl. So the naloxone or Narcan will work on the fentanyl, and that's the most potent part of it.
Destiny Patterson, WRAL News.
The White House's plan includes increased testing and standardized data collection.